Hello, my name is Miguel. Welcome to the channel. I'm a second year X-ray student, just giving you some tips and advice for new upcoming X-ray tech peeps. And in this video, we'll cover basic patient care, which you'll take through the program. Which, like I said, each program is made differently. So in mine, we'll take that during the first semester. And essentially, the first class of basic patient care, you learn it's kind of some of the things are some of them are common sense, like how to use a basic fire extinguisher. You learn about like how to help the patient onto a wheelchair, off a wheelchair, how to disassemble a wheelchair, to take X-rays, how to transport patients on a stretcher, how to transfer a patient with oxygen tube, how to transfer like patients with a seat collar. Let's see, what else did we have to do? Basic like how to observe your patient and see like when you're taking an X-ray, and then once you're finished to see if they're doing okay, like to have some of that pre-judgment so you can see, okay, oh, my patient's not looking too good. Maybe I should help him rest, or I should help him more because he looks like lightheaded, or like, you know, simple things, you know, to watch out for. You learn about that. And then you'll learn how to do aseptic technique, which it's not used too much in the day-to-day X-ray. That's more for special rotations, like in cath lab, surgery, or IR. You'll do those a lot. But I haven't seen too many people really do it. They use some special kind of liquid that helps them perform aseptic technique. I've seen more people do that. This is more simple, less time consuming. And then the class, like on a whole, is just like you'll learn just the basic thing, like basic protocols around your hospital, like code stroke or code aided, or like code, just basic things. And then you also learn about how different generations behave and how different cultures behave, because different race and ethnicities, they'll tend to have a certain way to act. Maybe like in certain cultures, the men will be more aggressive, and then if you don't know, you just take, oh, he's being hostile with me. But once you learn that certain like cultures or races behave a certain way, you'll understand that, okay, he's not being hostile, or he's not being mean with me, that's how he is. He's just being overprotective, or, you know, he's just worried about his health or his family member. You learn about that. And then you also learn about how kids from the newborn stage all the way to their adolescence, you learn how, depending on their stage, they'll behave differently. You'll cover that too. And then you learn about how like basic protections around like radiation, how like to watch out for some hazards, or some electrical hazards, or like if something spills, if it's chemical or biohazard, how to watch out for it, and how to protect you and your patients. And like, what are the safety guidelines behind it? And some basic stuff like that. Nothing, to me, that class was kind of more basic, like common knowledge. Some of it makes sense. For the most part, I mean, the book covers like the base, like you're not going to really learn nothing too hard. I mean, to me, the most part I struggled with was like the microbiology part, where you learn about like the small, like mitochondria and some small things like that. I believe we covered in that too, because it covered some diseases and stuff, how to watch out for that. That was the only part I kind of struggled. And pharmacology, at the end they had like a little bit of pharmacology on it, which wasn't too bad. But overall, that class to me was more easy. I had a higher grade always compared to the positioning class we took. But you have to be careful when you're doing labs, because your instructors will be grading you hard to make sure you don't mess up on certain things. Well, I don't know how it is in other schools, but in mine, if you would mess up on like one thing, you would have to redo the whole thing over. Like, you learn like how to take blood pressure, which personally I'm not too much a fan of. I struggle with it because I can't hear the blood count, like when it's pumping. Like I can't hear it too much to hear the diastolic and systolic. Like when we were doing that, you had to perform it. You had to like make sure everything was clean, make sure you talked to your patient, did all that properly. And like I struggled to get the right count on their blood pressure. Let's see what else. I mean, for the most part, at least in my program, it was like a PowerPoint, and you just read the chapter before, and the teacher would just cover it. It wasn't nothing too bad, I think. And the whole concept was just trying to understand you as a X-ray tech, how to help the patient, how to keep him safe, and how to not get hurt while like moving the patient, like proper body mechanics. That's a big emphasis, which they did, at least for my course. Yeah, this to help you so you don't get hurt out there. And let's see. Oh, and then we also did a lab over like basic temperature check, which I mean that's not really hard, but you learn how there's different thermometers depending on if it's a baby, if it's a doll, and then how different, if you read the temperature in different parts of the body, how the readout will be different. And then what else did we have? Oh, and then towards the end, we did a basic. We would have to like perform if we were transferring a patient from like, let's say, the ICU, which if you don't know, the ICU is for the patients who are like intense care. So basically they're going to be strapped with every single goddamn like wire. Like they're going to have oxygen masks and tubes, blood pressure, the IV. Like basically they're on life support, and you're expected to move them, and like you'll start from the beginning, like transferring the patient onto an X-ray table, pushing them back, moving them, which in the real world you would not touch that patient and do all those things, because something bad would happen. But you learn that because sometimes you do have patients, maybe not with that intense amount of stuff on them, but we've had a few patients, at least in my clinical site, where they have several things, and you got to be precautious and watch out to make sure no lead or like cable or something gets unplugged, because you know it could like affect the patient's health. But overall, it's not a hard class, I don't think. I mean, like I said, I'm just average intelligence, and I made like I think like a high B in that class. And for those who don't know, at least in mine, you had to make a 75 or higher, which that's what you need for on your board. So they made it 75 or higher for your grade across all the classes. I mean, testing wise, it's just we do tests, homework, some basic homework, and then the final. I mean, overall, it's not that bad. And I mean, I guess for my next video, I can teach y'all what to expect during the spring semester of your freshman year. And yeah, hope y'all enjoy.